And while the big story becomes all of us bracing maybe for what is lying ahead in terms of the pandemic, unfortunately, in the past 2 years of this pandemic, one lesson that we still haven't learned is to give due respect to our COVID warriors. We call them the COVID warriors, don't treat them like that. As I speak, there are protests happening in multiple parts of this country. Healthcare workers, ASHA workers, doctors, nurses, for various reasons, up in arms with a variety of problems, from being overworked to shortage of doctors, from their pending dues to unpaid dues to delay in admission process to lack of resources and support. So many issues. And just one demand that they have: listen to us, hear us, and help us resolve our problems. For all the grandstanding that we do about our COVID warriors, as we speak, from Delhi to Karnataka to Tamil Nadu, protests are going on. In Karnataka, in fact, the protests have seen a fresh twist. The latest order by the Karnataka government has added insult to the doctors' injuries, with the state government now saying that 10,000 per month COVID allowance that was promised by them to the COVID warriors will only be for those who are wearing a PPE kit to perform their duty, and not others. Quite naturally, agitated by this weird condition by the state government, the doctors are continuing with their statewide protests by boycotting OPD services. After a massive uproar by the doctors, Karnataka Chief Minister has said that the pay of doctors has been approved, arrangements have been made. Why do they have to protest and outrage every single time? Whether it's about paying their COVID risk allowance or compensation for the work that they have done during COVID times, whether it's about restructuring their academic fees, whether it's about timely payment of their stipends, whether it is about expediting the PG NEET counselling. At every stage, why is it that our COVID warriors have to resort to such desperate measures, which is not just about them, but impacts you and me, impacts us during times of a pandemic, impacts an already overburdened healthcare services system when they go on a strike and they go on a protest? Why doesn't it matter to our governments? I don't know. Let me tell you what's happening in Tamil Nadu, another state where in the city of Chennai, government hospital doctors have boycotted OPD services, protesting against the delay in NEET PG counselling. Doctors say the delay is causing them mental trauma. In Delhi, just a few days ago, 5,000 doctors protested for the same reason. The resident doctors also stopped their OPD services. In Gujarat, a few days ago, 1,500 doctors went on a strike, protesting against the delay in NEET counselling. Hundreds protested over pending dues as well. State after state, it's the same problem. When will we go beyond words and actually start showing some support to our COVID warriors? Tonight, I'm opening up the phone lines. I want our medical fraternity and their loved ones, their family members, to pick up the phone and raise your voice. Tell us, what is it that you want your government to do? For far too long, we've only spoken about how we care for you, and on Doctor's Day or Medical Day, we will come to you for special conversations. But tonight I say, let this be about your issues, and let the country and the government hear you out. So the phone lines are open. Do call us. I say good evening to Dr. Datta, Junior Resident at AIMS and General Secretary for Federation of All India Medical Association, Dr. Pranav Jadhav, Vice President for Central MARD, Dr. Kirti Varman, General Medicine Resident in Chennai, Dr. Nagendra from the Mysore Medical College joining me this evening, Manish Singla, NEET PG student, and Surya VK, also a NEET PG student, joining me. Let me actually start off first with the doctors. We'll go to the students in just a bit. Their future hangs in balance depending on when a government decides to decide on its policy, change its policy, then inform the court, and hence a lot of conversation. So it's far, far away. The wait for these guys is going to be long. But meanwhile, who's the one who's also getting impacted? Dr. Datta, it's you guys who are waiting for some help to come in, and that's not happening.
Yeah, so thank you, Tanvi. Let me just make a few things clear here. So usually the NEET PG counseling happens early in the year, and by now, if the COVID wave was not there, we would have already had a SEM of doctors over. So we understand the COVID is here and that it delayed the exam, and finally the counseling. Now, let me tell you that the recent court verdict, which was basically the case was against the government of India for the sudden and sudden announcement of the implementation of a new reservation policy. So what happened was that the court gave its verdict that the government should justify its reservation policy, for which the government asked for 4 weeks. Now, we all knew that a third wave was imminent. And why it becomes more important right now is because we are aware that Omicron is in the country. And at this point of time, we need to gear up with two things. Number one is infrastructure, and number two is manpower. Infrastructure, we are all aware how our public healthcare system is. It has been neglected for decades by policymakers. Let me tell you the ground reality about the manpower. We are severely understaffed. Doctors, resident doctors, they are the backbone of the healthcare system of the country, and they have been working with just 2/3 of the required manpower. And the exam dates for our final years have been announced. Once they go on for exam and academic preparations, the entire healthcare system will be shouldered by 1/3 of the required manpower. And this will be disastrous if an epidemic wave like the COVID comes. This was the only reason to protect the healthcare system of the country and to prevent the collapse of the healthcare system and to prevent our colleagues from burnout, from the immense workload which we are having in our government hospitals. We had to decide that we have to go for a nationwide strike. We have been protesting for the last 1 week. And from tomorrow, let me tell you that 90% of the resident doctors from almost more than 15 to 16 states all across the country, including Delhi, will be going on an indefinite nationwide strike just to ensure that the NEET PG counseling is done on time and the doctors are recruited so that our country's healthcare system does not collapse.
So let me just explain to our viewers as well, although we've repeatedly highlighted this issue here on Mirror now. Essentially, over the NEET PG, there was in July earlier this year, the government issued a notification for the implementation of the EWS quota. And then that was challenged in the Supreme Court. This challenge was filed in about September. The Supreme Court asked the central government of its view to respond to the notice and the petitioners. And there was much delay there. By the time the government got around to it, it was already counseling time. A little bit of back and forth happened during the court hearings, to the point that the government, one day before the admissions process was to start, the government went to the Supreme Court and told them, okay, we will revisit the contentious criteria for the EWS quota for NEET PG. The contentious criteria is about having a cap on the income criteria of 8 lakh rupees, and many say it's too high, you need to reduce it. And that's where the back and forth is happening. So the government said, okay, we will think about it, we will revisit this criteria, give us 4 weeks time. And while we think about it, let's put this admission process, counseling process on hold. And that is why, Manish, you and others today don't know when it will happen for you. 4 weeks would be a conservative time, but obviously in 4 weeks, the government will go to the court and tell them what they've decided. And then the court will have questions to ask, and at some point, decision will be taken. What do you have to say about this delay and how is it impacting you, Manish? Manish, I think you're on mute. You'll have to unmute yourself.
Hello.
Yeah.
Good evening, ma'am. Ma'am, actually, we need to understand that this exam was supposed to happen in Jan of this year. Already it was postponed first in April, then in September. Already, so students have lost their 9 months. Then the counseling also was supposed to happen in October. Then a petition was filed regarding the reservation and all, and the exam counseling is then further delayed in November. Then again, the Supreme Court has given the date as for 6th January for next hearing. And we are not even sure that whether on 6th January the verdict will come or not. So basically, ma'am, all the students who have preparing from last 1.5 or 2 years, they simply don't have any idea what to do now. Like they are jobless. They don't have option to go for job also because anytime counseling can happen. Also, the students who are on margin, like for their dream branch, they don't know whether to sit for next year or whether to read for the coming exam next year. So basically, the government has left all the doctors who were supposed to get admission this year like clueless what to do now, because we have no idea like what to do next.
Yeah, I'm really sorry that you're in this position. And like you said, exams that were supposed to happen by January, by summers, you would have had a
Yeah.
clear idea of where you would be well into that academic calendar by now. And it's not even started, and you don't know when it will. Surya, how have you been
Yeah,
dealing
we
with this
don't
delay?
even know
Yeah,
whether the verdict will come on 6th January or not. We don't even know.
yeah, I do.
And also we know that COVID third wave can hit any time, and
Yeah,
hospitals are facing a shortage of doctors. They need a new man force.
absolutely. Dire situation here. Surya, how have you been, managing all this while with all these delays?
Yeah, like Manish mentioned earlier, it's been almost been basically this NEET PG was supposed for the batch of 2014. So we finished our internship in last year, March. Most of our batchmates finished in March 2020. And since then, we was expecting it to be in January, and like he said, it has been postponing. If you talk to any medico in the country, all they would say is NEET PG is one of the most important phase and time of their lives, because it's the one who goes through it knows how hard it is to get through in the first place, and second, how hard it is to get through the residency in general in India. So having said that, there's one big, huge issue that has been being ignored amongst us. I mean, by others as well as us, is the mental impact it has had on people, and it is having on people like me and my batchmates and my friends. So, like Manish mentioned, it looks like an indefinite break, and just let it's not just about us. I mean, if we talk about my countrymen as well, the people, it's not patient. There's one third work, like Priyanka, my friend mentioned, one third workforce that is present at home doing nothing, and already we are understaffed, and one third workforce not working is disastrous for the country, and the government and the courts have to fasten the process. I don't know what is the solution to it, but they need to put the process as well.
Yeah, and the fact that many are also highlighting is that you already gave this exam before the new notification came through, and so should this even be applicable? In fact, the petitioners who've gone to the court challenging this law itself are saying that it's okay, you let this batch go, decide on the policy and implement it from next year. That's also fine. But for some reason, the government seems to have put this on hold. And they are saying we are going to do a rethink here. Dr. Pranav Jadhav, any conversations that you've had with the government authorities as to whether they're going to fast track this or not? You all have been now protesting for a while.
Yes, we had conversation with our health minister twice. Our national association, like four, had a meeting with our health minister twice, and he has assured us that with some positive news till Thursday. So we were waiting till Thursday, and what we have in our court is that central government has asked for more 3 weeks to expedite the NEET counseling. So how the central government can expedite this NEET counseling with the help of the 3 weeks? So my question to the government is that considering the new COVID variant Omicron, the situation can be disastrous to manage this third wave only by 2/3 of the batches. So is the government ready to manage the third wave with only 2/3 of the manpower? And yesterday, while we have an interview with Dr. Delhi BJP spokesperson, he said that those who have passed, they have been recruited in somewhere hospitals. But that is not necessary that those doctors that are working in Indian government sectors. We are here talking only about government medical college.
Yeah, and you're talking about it. In fact, you've raised a very valid point that you and I were arguing with the BJP spokesperson yesterday. Let's try and explain it to everybody who's watching this show today as well. Dr. Kirti Varman, I'm going to come to you. Explain to us this problem where the seniors have already moved on and gotten out of the hospitals. The juniors are yet to join in, and all the burden comes on the second year batch, because the argument being given by the other side is, so what if the seniors have gone? They've ended up becoming doctors only, and they're probably in some hospital any which ways. So how does that add to your burden?
Actually, while speaking, we are speaking about the counseling day. But actual thing is the exam itself, NEET PG 2021 exam itself was delayed. Yeah. Actually, Jan 10 was the date which was announced at the beginning. Not conducted. At that time, the COVID cases were also less. It should be conducted. It should be conducted in Jan 10 itself. It had been then changed to April, and then April also it was not conducted, and it is conducted in September only. September 11 only the exam itself conducted, but till the counseling have not been conducted. Nearly 1.15 doctors have been written this exam. They are waiting for counseling. They are stuck up like our friend this before. They have been stuck up because this is the most important exam of career. And these 1.75 lakhs doctors have been waiting for this thing only. They are stuck up. They cannot go to a job. They cannot go to start a clinic. Or they can't do their work. They are stuck up here itself. We who are working in hospitals, as you said, we have compromised. 1/3 of doctors are not here. In the meanwhile, we had a COVID second wave. I mean, we had COVID second. We are going for COVID vaccine duties. In the places like Tamil Nadu, we have floods, flood camp. We are going for flood relief camps. Then dengue outbreaks are also here. So we are worked up with more stress. So workload is increasing and increasing. The manpower is not there to manage this at all. This is what the issue here. And the most important thing is nearly 2021 December came now. Until 2021 back, not even and this makes a dangerous situation that this academic year can become a zero academic year, and this is a very dangerous situation in medical colleges now, and this should be taken an important concern, and this counseling must be conducted as soon as possible. In the same way, the work stress and as well as the mental stress, as well as the psychical stress, physical stress, everything is increasing. The recent days, particularly to want to say, June, July 2020, these 2 months, June, July alone, nearly 10 young doctors have been suicided because of depression. All these doctors are aged less than 30 years. So this is the most important thing to note, that the work burden for every desk doctors have been increased. And then, on the same way, now we are in afraid of this third wave and new strains, and this is very important concern. And people,
Right.
Yes, important concern, and it is a public health issue. So manpower is very important thing in country like India, and manpower is very important in healthcare system. Manpower is important thing for patient care. So this is all important in situation like that. If we face another pandemic situation comes to India, it will be a very dangerous situation. So without any delay, the counseling should be conducted as soon as possible without giving any reasons. This is what going to be a good welfare people as well as doctors.
Yeah, Dr. Varman, and I know all of you are highlighting this because obviously all of us are right now thinking about what's going to happen in the next few weeks with the new variant and its impact on our country. But let's also keep in mind, even if that threat was not there, there is already too much on your plates. And the problems don't start and end with just the NEET counseling delay. It starts from the fact that you're already understaffed. It starts from the fact that you're already underpaid and overworked. The salaries are repeatedly for this part or that part, this category or that category, in this state or that state, repeatedly delayed. Changes are made which are not helpful. These are also some of the issues, Dr. Nagendra, that impact youngsters who are supposed to be otherwise working right now in these hospitals, government hospitals, and fighting the battle for us.
That's absolutely right. First of all, I feel very bad that we have been in such a situation where doctors, we are demanding to proceed with the NEET counseling. We have worked hard. I mean, my juniors have worked hard. They've taken the rank. They're just waiting for the seat, which is just empty. And the worst part is the public and government is thinking that it's their academics, the doctors, they have problem. We don't have anything to do with that. But the problem is, if we are weakening the healthcare system, it will affect the overall country. If you think it's just the problem of doctors, it is not. It's the problem of every individual of the country. And already the doctors, after it is one of the most stressful jobs, and it's very difficult to even get the MBBS one. Even after that, you will prepare for NEET and you get you want to proceed with MD and MS. Your age will almost be 26, 27, and you are independent. Some may be married. And all these things, many people are dependent on you. So you have to earn and you have to do a living. And if you think that even if you delay the need counseling, you can work somewhere and all, no, it's not the thing. I have my juniors, I've talked with them. Some are in dilemma whether to work, whether to wait, whether to read again, or whatever. They're just in a dilemma. It is, I feel, a very bad situation where we are stopping the OPDs. We are coming out with banners and placards. We're just making a march and begging the government to just fasten the counseling process. And I don't know
Managing,
how
Dr.
they
Nagendra, tell us on a daily basis how many posts or vacancies are there in your hospital, and when the extra load comes in, how do you deal with it? How long do you work every day?
See, we have the postgraduates around 120 or 120 to 130 seats are empty as of now. And what happens is this PG system, the what a post graduation is 3 years course, and first year, second year is not the same. You have to escalate yourself. What the first year work does, second year work does, it's totally different. So whatever the first year was not come hit, the second years are getting hit more overburdened. They're working overnight. It has been very tough for us. It's very difficult to do the first year job for 1.5 years or so. It has been difficult even for the postgraduates, what we are, and even for the NEET aspirants who have just finished the counseling. And regarding this is our academics. It is affecting the academics. When you're overburdened, you cannot do what you want to do at the right time. So I feel it should be fastened at a very fast pace, and the government should prioritize which the healthcare system has to be given utmost priority, that too at this situation of the COVID era.
Okay, let me bring in a few of our viewers as well, calling in to share their views, and then I go back to our panelists. I request all of you to stay with me. Purna Chand calling us from Gurugram. Good evening. Go ahead, please.
Yeah, ma'am. Thanks for running this show. I just wanted to take up the case of my son, who is a PG resident in Maharashtra. He joined as MS surgeon last year, and because the new batch has not come, he's still struggling doing the duties of both the years. He is not effectively a second year. He's still in first year, 18 months, and does not know when he'll go into second year. By the time the new batch comes, he will have hardly 2 months in second year, then he'll move to final year. And imagine what kind of experience he would have when he passes out. And the new batch that comes will hardly be 2 months into the first year, and they'll move to second year. So this is a problem, and he's handling the trauma department all alone without any support, handling 15 deaths in a matter of 25 days. This is a huge problem. The trauma the doctor himself will undergo, you have to understand. And he's down with dengue after facing all this. So these are the difficulties I know my son is facing. I'm sure many of his batchmates must be facing. So this problem has to end the soonest and tomorrow.
Unimaginable, Mr. Purnachan. Thank you so much for calling, and I can't even begin to imagine what your son may be going through. And you know, this is the point. If we don't understand, we're talking about the medical fraternity here. We're talking about doctors whose job it is to treat us, to make us better, to make us healthier, to save lives. And in times of a pandemic, if we can't get the importance that their role has, then I don't know when will we wake up. And that's the point I want to repeatedly highlight here for our governments. Thank you for calling us, Mr. Purnachand. Let me go across to Dr. Sri Ganesh calling us from Bengaluru. Good evening. Go ahead, please.
Yeah, good evening. My point of view is, see, the residents of the country, the resident doctors of the country make the backbone of the health system of the country. The whole hospital functions because of residents and no one else. So the main backbone are the residents. So as of now, what is happening is, it will be surprised, you guys will be surprised to hear that, when the resident goes to his hospital on Monday morning, he comes back home maybe on Wednesday morning or maybe not. He might come back on Thursday directly. So he'll be working 72 hours to 96 hours straight with 2 to 3 hours of breaks in between. So that usually happens in every single time. And now because of COVID, it has been increased, and PPE kits have been also implemented. So because of that, the stresses increased so much. And as of now, it is 1/3 of the workforce is just sitting at home doing nothing, like me. and we, even if we want to go and work, we don't know, where to go and work. So, we are just all hoping for the counseling to begin. And looking at this, they're telling that they will revise the EWS criteria. They'll review the EWS criteria. Even if they do that, they'll have to issue new certificates or something. So after that, we know how fast it is in India to get certificates. So it'll take 2 to 3 months at least. So we don't even know when the academic year, which was supposed to start in May 2020, it has not yet started, so we don't know when it is all going to start. And if such basic things cannot be understood, I don't know what else is understood.
Yeah, and what I also feel sorry about is that this case was in court. And the government was unable to highlight the urgency of the case to the court itself to say, okay, we need to fast track this and expedite it. It's an important policy matter. It's a long-term policy that we need to discuss, and maybe if you have to revise because people want it to be revised, that's fine. But it has to be done on an urgent basis. Dr. Datta, there have been conversations, and Dr. Jadhav was talking about it. But I saw something that you put out which indicated that the assurances that you got were contrary to what is actually being done. Now, where is this misunderstanding or disconnection coming from?
Yeah, so I'll just tell you what we have done. So we have national associations who are working at the central level in Delhi. So myself, I'm the general secretary for the FIMA, and we have been protesting, and many of our associated state RDAs, almost from around 8 to 9 states, have been shutting down their OPDs since almost 2 to 3 days, since 1st December. Now, there is another association of which Dr. Pranav is a good friend and is a part of FORDA. So they had already had a meeting with the Ministry of Health and Family Welfare, who had assured them that it will be sorted in 3 to 4 days, which meant that the court hearing should be happening on Friday. However, we all know that just 2 days back, there was an office memorandum by the Ministry of Social Justice and Empowerment, and they gave 3 weeks time for deciding on justification for the EWS reservation policy. Now, that is absolute betrayal, because if we have been promised that it is going to be sorted, and we respect your promise, and we go back on our decision to strike or withdraw our services, just by keeping faith in you that you have promised us and you will get us justice, then you should also respect our decision. But it did not happen. We had an emergency meeting yesterday with the Ministry of Social Justice and Empowerment. Myself and our president and our national chairman from FIMA, we had met, and we explained to the ministry about the seriousness of the issue, and they have promised us that they will be looking into it. But as we all know that we are not immune to false promises being made by governments and policymakers. So right now, from tomorrow, all the stations, including FIMA and FORDA, we have already declared that we will be going on absolute withdrawal from all elective services. However, keeping patient care in mind, we are not calling our staff who are employed in the emergency services, because we do care for the healthcare system. And whatever we are doing right now is in the best interest of the country, because if we do not have adequate manpower by the time the COVID third wave hits us, then our healthcare system will be absolutely dysfunctional when it hits.
Yeah, and already you're also stretched. Already you've worked so much for the last 20 months. To expect that you will be ready and raring to go with all your might in an understaffed situation for the next wave is just inhuman. I mean, I don't know how else to describe this.
In fact,
let me bring in Surya at this point, Surya, because it's also about the experience that you are also missing out on, all the learning that you could have done by now, and actually joined the overall doctors' force in our country by the time the next wave came.
Yes, I totally agree to it, because we were just thinking there's going to be 2 waves. And in fact, I personally was thinking when I joined in, I would not have COVID duties, and my learning curve in my residency, which is the most important part for any doctor, would be as good as it was 3 years back. But then the COVID situation, we never know what is going to happen. And just imagine the resident, the currently who's working, has been a part of the COVID duties for the past 2 years. Like the uncle who had called earlier mentioned, it's been second year, he's going to be in third year. So, and the experience he has got in 2 years is as less as probably close to what a first year would do 3 years back. And for us, though, when the government had asked us to work, we did work during in the month of May when the Prime Minister asked us to work, we did work. But again, like you mentioned, the learning curve, the exposure to different things are currently, these are the most productive years of our life at this moment of time, 20 to 30. And we are learning literally nothing to save our people or help us grow in our careers.
Yeah, it's really quite unfortunate. I know a lot of it is to do with the pandemic and how that's thrown everything out of gear. But some of it could have been handled better if we had planned right and the governments had reacted at the right time. And that's the point which is problematic. Dr. Kalash is on the phone line. Good evening. Go ahead, please.
Yeah, good evening, everyone. Hello, Surya. Hello, Subhankar. I want to say that this is not just this one issue, like against residents that we are suffering. There has been a general apathy towards residents and doctors in particular, from the government, from the politicians, from the judges. We are actually the most expendable people in this country. This is not just, this particular issue of doctors not getting supplied in the government hospitals. The residents, they are dying for 1.5 years, the first years. That's the most difficult time in life of a doctor. And it's not getting over for them. And it's not just this one issue, right? Like if you see in the past, whatever demands we have, unless and until we go on a strike or we wear black bands on our hands, it does not resolve. We have to always resort to come on the streets, to threaten to stop our work. Then only people listen. So I feel not just this particular issue, we have to talk about how people see doctors in general. Okay, that was what I wanted to say.
Dr. Kalash, thank you for calling and sharing your views and raising your voice. I think, all that we can do is, try and amplify what you're all doing in our own ways and hope that the government responds at some point. Let me also go across to Imthis, who's on the phone line calling us from Hyderabad. Good evening. Go ahead, please.
Hello, ma'am. I'm Imthis Hussain speaking from Hyderabad.
Yes.
Doctors, we call them they are the blue-eyed boys, and we are using them like anything and not paying them anything. And also, they are suffering for the last 1.5 years. The interns, they have completed their interns no exam, and counseling yet to start. What is this government doing actually? Is the government is only for campaigning the election, or they are looking for the doctors?
Well, I will tell you it in a very simple way. It's a little harsh, but unfortunate truth that it's not a vote bank. If it was, if we had as citizens made healthcare itself a voting or an election issue, perhaps the governments would take it more seriously. What's worse is a lot of this, what we're talking about today, is linked to the government hospitals. Now, if we had the private hospital stepping in, and the powerful and the rich and the influential or even the middle class getting a lot more impacted because of that, and them coming out and speaking about their hospitals not functioning properly, maybe the governments would have heard it. But because this is the government hospitals and the patients who go there don't have a platform to raise their voice, and neither do you guys, because there is so much work that you have no space to do that. You are stuck in a place where nobody is hearing you. That's the unfortunate reality. Manish, let me one more time ask you, if the government is listening to you today, what is it that you would like to say to them?
Ma'am, we have asked the government and still we want to ask the same. Like, they have announced their policy after we have the exam. So basically what we asked the government is to conduct the NEET counseling this time at least with the previous policies, and we can wait for another 1 year. Like, court hearings can be done and the court can decide whether the government decision is right or not. So it's better to conduct counseling right now with the previous policy and let the case proceed in Supreme Court according to their hearings and all. So that at least the time of aspirants will not be wasted.
Okay, fair enough. A point, and I think this is something that the court needs to look at. If the government can't go back to the court, hopefully the petitioners do, and a date is given for an urgent hearing to hear this part. Let this admission process go ahead. Decide on your policy. Don't rush on your policy and implement it from next year. Dr. Jadhav, would that be an acceptable part to most medical fraternity stakeholders?
Yeah. Also, they will get sufficient amount of time now to think over the policies and all.
Correct. Correct. Yes, Dr. Jadhav.
I think Honorable Supreme Court is very competent to announce a result about the reservation. We just want to expedite the NEET PG counselling. The decision regarding the reservation is hands in the reservation of the Supreme Court itself. So we respect the decision of Supreme Court, and we just want to fast track the NEET PG counselling so that the first year PGs who deserve to be in their medical colleges can join the respective medical colleges and start to work. Considering this new pandemic, considering this third wave, we expect the new additional recruitment of the resident doctors. But forget about the additional recruitment. It seems that the government is not even ready to. Recruit the first year PGs in the medical college itself.
Yeah, that's one other issue that the government needs to look at. I'm going to thank all of you for joining me on this conversation, and hopefully, the government or the court, somebody listens to you and comes up with a solution that works. Here is what I just wanted to leave our viewers with. That for all that we say repeatedly, how much this pandemic, the battle against this pandemic was because of the doctors, our frontline warriors, our COVID warriors. Why is it that when it comes to their issues, we don't seem to care? We don't seem to think it is important. Why is it that in state after state, when their salaries are not paid to them, or the salaries are delayed, or their additional bonuses or stipends don't come in, or the salaries are not increased year after year, we don't seem to care about it? Why is it that when they are already in our country, there's a massive shortage of doctors? There's an additional shortage when it comes to the government hospitals. On top of that, we've said now that because of the delay in the exams and the admissions process, and now flip-flop on our policies, further admission process has been delayed, further impact on the manpower, and we seem to pretend as if we just don't care. The governments and various ministries are having meetings with various representatives from the medical fraternity and the resident doctors saying, okay, we hear you, we will look into it. But with every passing day, these young doctors are facing the burden getting stretched, and it is impacting them. It is impacting their services. It is impacting them and their skills and their learning. And that is just not fair. This needs to be treated as urgent as any other part of a pandemic war has been. If we think battling COVID is an important aspect of what we do as governance today, then listening to our COVID warriors has to be an equally important part of that process. Thank you for joining us.